So good afternoon, everyone. I usually like to walk around as I talk, so I won't be sticking to the podium, and I might also digress from the slides. So thanks to Elliot for that very generous introduction. I started off as a medical rep in Canada, and I've worked my way through a number of countries and functions into today this function in China, which is MD for BC, Provide Healthcare in China. And as my country manager in Hong Kong always reminds me, I have to say China and Hong Kong. Yeah? So thanks for that introduction. Now, there are just three things I'd like to tell you about myself, right? The first one is I'm an implementation guy. So we see a lot of bullshit, but you need to, as an implementation guy, keep things as simple as possible. There's a lot of options, there's lots of strategies, and the basic rule I apply is, if there's a strategy and I can't explain it to my 10-year-old daughter, in her attention span, not in my attention span, then probably implementation is going to be challenging, all right? So, because usually in pharma, implementation takes place through a lot of connections. So the first rule as an implementation guy is keep it simple. The second one is I'm a bit of a conservative guy. Yeah, just my nature, I guess, right? So the idea is to look for the smallest thing that can make the biggest difference, right? You don't want to change too many things. Look for the small things you can change that make the largest difference, right? And of course, as my job, as in a lot of jobs, my results and my performance is very transparent. There's sales growth, there's compliance and governance management and robustness, and there's cost reduction, right? That's all an MD has to do, right? So the idea there is to not only look for good ideas, but ideas that show results, which can be read by a simple implementation guy in easy numbers, sooner or later. Okay? So my presentation will focus a bit around that. And having said that, I do believe that integrated marketing or multi-channel marketing is an important tool, is an important strategy for us to provide value in our communications to physicians. But before I go there, let me just start off with my presentation. And this is really just food for thought for everyone. So now we know the big numbers, right? This is my disclaimer. This is me, not as head of healthcare in China, but as Alo presenting, okay? So this is a given, right? So let's if we were to take Bob's very nice presentation, since we are in China, since we are in Shanghai, we can say there's no other emerging markets, really. China is the story, right? Could we agree on that since we're all in China, right? There are a couple of regional guys, but they're here in China because they know China is the story. And I was at a dinner a couple of months ago, actually, and we said, what if China has a crisis like the Asian crisis of '98? Right? In 1998, if you remember, in Southeast Asia, there was the major crisis. I think the Indonesian rupiah went from, how much? From 2,000 to 10,000 or something crazy like that, right? And if you do the math, you take China's percentage of GDP, you take China's percentage of contribution to growth of GDP. If China goes into a recession, the world nearly goes into a recession on a global level, on a global numbers level, right? So of course, we know that China's an important market. However, there are two factors. The first one is that this is inevitable to a very great extent. Now, this is a slide. I love this slide because it makes people think that I'm very, very long-term oriented. This is taken a portion of GDP since one BC since the birth of Christ till today. Yeah? And the red is China, the yellow is India, and the green is the US. And you can see as economies were agricultural initially, of course the bigger populations had a larger portion of the economy. And then what happened was with the Industrial Revolution, of course the European economies expanded. And now in today's stage, as you can see post-2000, China is gaining a lot of economic, contributing a lot towards the global GDP. Right? And this is inevitable. We have long-term economic policies. We have the ability to implement these economic policies in a sustainable fashion, at least in 10-year cycles, right? And we have a large population. So this importance is, of course, inevitable. And then if you go to the second slide, this I saw in the FT world. Now, of course, given journalism is never very, very in-depth analysis and stuff like that. They have to produce a paper every day. But nevertheless, this was a reworking of the PPP, purchasing power parity figures, where China then got a kind of boost in the reworking of these figures. I think this was done by the World Bank. But it was a headliner in the FT, Financial Times newspaper, which showed that by the end of 2015, China in purchasing power parity terms will be ahead of the US. Yeah, just Google FT news and you'll see the slides there, or you'll at least see the chart there. And previously the forecast was that China would overtake the US in purchasing power parity terms in 2020. Yeah, so you can say that either we were under-reading the economic power of China, or you could say that the growth in China was much faster. Okay? And of course, this plays out into the healthcare market, where you see this real fast jumps happening with China. From 9th in 2005 to 3rd, and this year, thanks to the depreciation of the yen, yeah, to an equal second, I think. But that's primarily because there was a bit of a depreciation of the yen, but top 3, yeah? And maybe in 2 years it will be ahead of Japan also. So the importance of China as a market is definitely there. And of course, when you look at a pharma market, being healthcare, there's a lot of innovation in the product side, we know that. But change on the other side also kind of take a global approach. They start somewhere and then they develop elsewhere. And therefore, it's important for us in China to understand what works today, but also keep an eye on what will work tomorrow, day after, and in the future. And usually, for us in China, it's kind of lucky because we can, to a certain extent, understand the success and failures of experiments in other countries. Yeah? So I'm not talking about the healthcare, I'm talking just about the commercialization environment. On the healthcare front, what we can expect is quite interesting, because what Mr. Li Keqiang said was, he said that no country has a solution to healthcare, a sustainable solution to healthcare. Everyone is experimenting. And China will also experiment on its own. Yeah? So we have to find new ways of doing it. And therefore you have the challenges that your market access colleagues, or whatever you call them, yeah, your bidding guys or your government guys, will keep telling you about that it's different in this province or that province. But pharma has been able to manage it, right? And I'll come to that in a couple of minutes. And of course, this growth is still, despite this growth, there's still a significant unmet medical need. Yeah? So the key figures in this chart really are the treatments. Sorry. I have been taught how to use it. Let me see if I can. Yeah. So the key figures in this chart are really the treatment rates, right? Yeah. So you can see the upside that is there for additional treatment. Yeah, all the unmet, all the unmet medical needs. And this is despite significant And when I say significant, I mean significance that you can see in between trips for the guys who live abroad, in between trips to China, improvement in the healthcare system. I have this picture, I didn't put it up. There was a picture I had of a county hospital wherein it was a cycle was outside, it was the emergency room, there was a stretcher inside, and there was a light bulb. And then 3 years later, after the building of infrastructure in China, in the smaller counties and provinces of China, where it looked like a good 4-star hotel, more or less. It looked like a leading facility, right? So there's been significant commitment and delivery, and thus an improvement in healthcare needs, in healthcare outcomes, in healthcare intervention in China, that you can see over a 5 or 10 year period. Basic insurance has gone from 35% to 90%. It's 350 yuan per person, more or less, right, in the rural areas. But it's still over I think this is a 9-year period. Yeah, there's been this phenomenal increase in coverage. Yeah, there's still opportunity to improve, but we have to recognize what has been done. Yeah, out-of-pocket expenditures on a national level have dropped significantly. Okay, if you look at access, yeah, I was talking about the pictures. You can see that there's been a significant amount of infrastructure that has been done. Of course, the software to run it properly, to become efficient, of course needs to be developed. But every country is facing the same challenges, or still, is facing challenges, maybe of a different nature, right? Of course, there's naturally with healthcare costs increasing, with more access, there would be cost pressures. I have my own formulas, which I don't really like to share with people, but basically you have the National Essential Drug List, you have an EBS system that covers a large portion of the country and therefore provides good quality healthcare. And you need to participate in this as you go forward. You just need to figure out how, and you need to know what your objectives are. Okay? And of course, like other markets, there will always be challenges. If you just, I leave it as an exercise for you guys to do, just download data on GDP, healthcare costs, yeah, in a series by country, and see which year the pharmaceutical industry started getting slapped around on costs. And there's a number actually that you come to, yeah, which I leave it as a guess for you guys to figure out, okay? But there's a critical number which China hasn't reached yet, but where pharma gets slapped around. But there is healthcare reform, and it will create price pressures on us. It will create efficiency pressure on us. But it is also an opportunity. Right? So the big one, of course, will be cost containment, because they want to treat more people while not increasing the costs that fast. Right? And that would be one area which would be the trigger point, along with access to the physician, for change within our commercial model. We're not at the point of what Bob was talking about, all the real-world data or analysis of real-world value, yeah, will be a new driver of changing mindsets, changing data points, changing value of the pharmaceutical product, and increased uncertainty for us as we go forward in global markets. Okay. Now, when you look at this, and of course, market access is a challenge. And I was alluding to this earlier, wherein you need the cross-functionality in your teams, where you need the cross-functionality. You've divided your teams into a number of things because of governance issues, and now you need to be able to make sure that everyone works together to be able to bring the product to market, to create the value for the physician. Yeah? So all of you, I think most people here would be the commercial excellence guys, or what's the type of voice? How many are in commercial excellence or in multi-channel commercial excellence, or, yeah? Only 10%. Okay. So how many are in pure sales functions? Okay. How many are pure marketing functions? 10, 15%. Okay. So where's the rest of the guys? Where are you from? How many guys from the IT groups there? Right? One guy from IT, the enlightened IT person is there also. That's very good. Okay. So it's a mix, right? So, but of course there are market access challenges, and you always find it a challenge that you have to work together with the other groups. The marketing guys say the sales guys are not listening. The sales guys say the marketing guys are just sitting in the office. You know, the usual stuff, right? But pharma has been able to manage these complexities. Just look at Europe. Take the big 5 countries of Europe. Okay? You'd say there's one central authority now on regulatory, which is the same as China. But when you come to market access, each country has its own stuff. They have different models. And then you go to Spain and Italy, each province has its own stuff. Right? A bit like China. So if we can manage the challenges of Europe, I think we have the capability as an industry to learn to manage the differences that are happening across the provinces in China as they experiment, as they try to find their own models to some extent for healthcare. Yeah? And of course, there's physician dissatisfaction. They're extremely overworked. They are not very well paid. And then the demand on them as public servants, so to speak, is also very high. Yeah? So there is some dissatisfaction. And these are the 2 or 3 key things that we have to deal with when we talk about our commercial models. One is, of course, efficiency. The second one is access. So how do we get the information across? Because we all believe in the data, the good data that our companies produce, right? For the clinical trials, for the pivotal trials, the phase 3 trials, and for the subsequent data that is produced, usually in a very unbiased way. And of course, as an MD, and I'm sure all your companies have as much focus as Bayer has on this. Yeah? Compliance and governance is critical for us. Okay? And in our marketing thinking, in our new models, we have to also think about this. If you get too fancy in a new model where you lose control to some extent, you have to be a bit careful. All right? So not only do you look at models from a view of growth and efficiency, but you also have to look at it from a view of being able to implement it in a controlled way, tactically. This data is very easily available by Transparency International. So you can just download the slides from them. All right? So this is very important. We know the history over last year, right? And I know that most of your bosses and my colleagues are working very hard on this, and we need to support all these guys to get the industrial reputation at the right place. So how would companies respond? The first response, of course, I think this was a survey done by McKinsey of country managers in the pharmaceutical industry, is to bring your innovation as fast as possible into the country. Right? So to become more and more dependent on, or to bring your products as fast as possible into the country, as close as possible to the US or European or Japanese airlines, depending on which home market you're from. Yeah? So that, firstly, it's good for patients also, but also you have some kind of protection around the product. And you have some differentiation around which you can see. The second one is adopting commercial models, which went up 4 ranks. So here, there are a number of things, but again, being the simplifier that I like to be, or being the simple guy that I am, yeah, you just have to think of where the biggest bang is. Yeah, and think of it, when you're doing this and you're changing the behavior of 2,000 guys, or as a marketing guy, you might have 800 medical reps promoting your product. How are you going to do it? It can't be too complicated. It has to be done in simple, robust. Right? And you can see here, as was pointed out by Bob, that expanding the sales force actually went down as a criteria. Yeah, so there's an old formula. Again, it's just a formula. Take it for what you will. It does not undermine the hard work done by everyone, all your colleagues in the pharmaceutical industry. But there's a formula which says price point times number of medical reps equals sales. Yeah? Okay, it doesn't take into account all the stuff, but there is a method to that math. Yeah? But that part of the model, I think, is over to some extent. Yeah, you now might need to earn your own growth. You need to think in terms of not just growth alone, but efficient growth, which is governable. Yeah, that's the point. So how do companies respond? Firstly, of course, China was traditionally a single line industry. So one medical rep carried one product. Whereas when I was a medical rep in Canada, and I'm aging myself by telling you this, in 1994, yeah, I was carrying two products in two totally different therapeutic areas, one in hypertension and one in anti-infectives and antibiotics, right? And as a non-science, I was an engineering graduate, but as a non-science graduate in the traditional sense, I could understand both products reasonably well. Yeah, so that's one area to look at. Now, how you look at it, how you implement it, and how do you differentiate from your competition on that depends very much on the individual product. Yeah, think about it, think about the competitive environment, and then you think about how do you get this efficiency while maintaining the growth in a way that's comfortable. Okay, now the portfolio shift is not really been driven out of China, let's face it. Yeah, these are in research, in traditional research, the low-hanging fruits in cardiovascular, etc., have been taken up. We've brought in very good medication in this area, and as an example, I was reading that, say, in 1946, President Theodore Roosevelt, who at that time was probably the most powerful guy in the world, got hypertension. And he was advised to take a low-salt diet and not work hard. Yeah? Today, hypertension should not stop you from doing anything, right? Because of the drugs available. So we've gotten our low-hanging fruits, and now, of course, there are other diseases with unmet needs where we have to actually work on. So this move is more of a research-driven move than because of China. But nevertheless, what it means for us is that these are the innovative assets we have in our portfolio as companies, right? And these are the innovative assets that we must try to maximize and commercialize. And the way you do these is slightly different from the way you did your traditional assets. Okay, so that's also a change. The nature of the therapeutic area itself will cause you to rethink your commercial models for growth. Yeah, and then of course your marketing approach, not only the bigger picture things, but the marketing itself. How do you innovate in marketing to be able to have the X factor, to be the one who rises above the noise so that you're remembered? Okay. Thereby making the task of your medical rep much, much more easy. Okay. So multi-channel marketing, what is it in my view? It's what I used to call integrated marketing communication. That means there'll be various ways, various levers of addressing one point to a physician. And we need to be able to use all these levers depending on their need. Need not in terms of information alone, but how they get the information. Right? And as you know, depending on the product and depending on the nature of the physician, these levers may be slightly different. And then we also saw that in this case, the traditional channels were overcrowded. There were a lot of competition in that channel itself. And therefore, it was also a very crowded space where differentiation was a bit of a challenge. Yeah. And this gives you an idea of which other options on how to achieve, how to get information, and how to get information about the product and how to get other information was viewed by physicians. So obviously it tells you, of course, that the medical rep is there taken for granted. Yeah? So that is a given. How do we give additional information, yeah, to increase the impact of these people? So again, I mean, this may vary by, I don't think so, it may vary by region, for sure, right? Because if you go out to the western regions, people enjoy meeting medical reps to a greater extent. But in general, for 60% of your sales, this will apply. Okay? And then the reasons why can also be quite easily seen. Okay? So the reason why is usually around efficiency and time. Yeah, during the day, I'm busy meeting my patients. I may attend a lecture, of course, to increase my knowledge, but email is when I need it, or the internet, or digital means help when I need it most. And therefore, what you could do is you could design an approach which is kind of dynamic, where you use the traditional media or traditional approaches which have proven themselves in the past. You don't want to take too big a risk, but you introduce additional sources, you introduce digital sources to support the entire. Now, you could do this for a product that has been established for a long time, or you could experiment during the launch of a new product also. Yeah, because when you launch a new product, you probably have more money, right? As opposed to when you're at the end. So you're doing it for different reasons. You want the uptake to be very good. And of course, if a product is established, you always, or your bosses are always asking you for efficiency. So that's one way in which you could perhaps work out the approach, the MCM approach, or the integrated marketing communication approach for each of your products. And the key learning has been that different therapeutic areas might have slightly different models. But the slight differences, in a tactical situation, the slight difference can have a big impact. So for example, if there was a traffic jam, and half the room was empty because you guys came in late, then that's a big impact on the end, but it's a small issue. There was a traffic jam for half an hour. Right? So that is something that you have to be aware of as you go through. You need to be able to think of what your product needs are and the challenges of access, and efficiency of growth, along with the important challenge of governance. And think of ways where you can leverage all the marketing tools in a systematic way. Not just the medical representative, but also all the other tools that are available to be able to get your message across to the physician. Okay? So thank you very much for listening.